Well, good afternoon, everyone. Today, I'd like to address some questions that we have been hearing around the use of personal protective equipment in schools. The government of Saskatchewan has procured, as I've said before, 6 million disposable masks for school divisions in Saskatchewan with an investment of $2.3 million. The purchase represents a supply of masks for school divisions until the end of the calendar year. Under current guidance in Level 1 of Saskatchewan's Safe Schools Plan, masks and PPE usage recommendations are in place in many of Saskatchewan's school division plans. Our government has been carefully monitoring the release of the federal guidelines by Public Health Agency of Canada and feedback from provincial stakeholders, including the Saskatchewan Medical Association, in regards to the safe return to schools. In consideration of those guidelines and feedback, Saskatchewan's Chief Medical Health Officer and the Ministries of Education and Health are actively considering a mandatory masking policy under Level 2 of Saskatchewan's Safe Schools Plan. As the situation with COVID-19 in Saskatchewan is very fluid, the Safe Schools Plan provides consideration to changes and updates as needed, as accounted for within the 4 levels. Under Level 2 of the plan, mask usage can be implemented under the direction of the Chief Medical Health Officer in consultation with public health, either regionally or provincially, based on the most up-to-date situation and specific scientific information that's available. The initial order of 6 million masks will be delivered and distributed to school divisions before the start of the school year, which is set to begin as early as September 1st, depending on local school calendars. These masks will be made available to students, to teachers and staff at the beginning of the school year and on a daily basis. We know that parents, students, and teachers want to return to school safely, and our government is committed to continuing to work with school divisions and our partners in education to make sure schools are safe and that our kids can come back to school again. Thanks very much. I'm happy to take any questions that you have.
So right now, masks are not mandatory, only if it goes to Level 2, and in what way would we know that we hit Level 2?
Well, Level 2 will be determined in consultation with the Chief Medical Health Officer. Currently, the plan is to return to school under Level 1, but as I've said, there's been some consultation between the SMA with representatives of the Ministry of Health and the Ministry of Education to determine whether or not that should change. Certainly, there were some guidelines that came forward from the federal government today, which was recommending mask usage on the return to school. Those are all things that are being considered in consultation with our partners in education and our partners in the medical community to determine whether or not school should start at Level 2. So those are ongoing conversations. I can tell you that the response planning team, which is made up of school board trustees, the STF, the Teachers Union, and the Ministry of Education, are all giving some consideration to the new guidelines that have come down from the federal government, including looking at information that's coming from other jurisdictions so that we can make sure that our kids go back to school as safely as possible in September.
But as of right now, it's still Level 1, no mandatory masks.
It's currently at Level 1, but again, there are some conversations going on with healthcare professionals and education professionals to determine whether or not that will change. We've always said that the plan that's been put forward by the province and the local plans that have been put together by the school divisions, and I want to thank them for all their very hard work, is very fluid. And so depending on the recommendations that come from our Chief Medical Health Officer, those determinations will be made in terms of moving between levels.
Minister Wyant, was it actually Dr. Shahab's recommendation to the government that mask use not be mandated in schools, or was his preference to have mandatory masks off the hop, and this plan was kind of a compromise between what Dr. Shahab had wanted and what government had wanted in regards to making those mandatory masks, I guess, right off the hop?
Well, we've always taken the advice of the Chief Medical Health Officer, and I think it's fair to say that the Chief Medical Health Officer has given this province excellent advice since the beginning of the pandemic. I don't think there's anybody that would disagree with that. So the advice that we have received from the Chief Medical Health Officer, based on the plans that have been reviewed by the RPT and by Public Health and his office, are not recommending masks, and that's part of his recommendation at the present time. But again, as I've said, that could change.
Do you have enough masks right now, and is a shortage of masks what's responsible for not having the masks mandatory on September 1st?
No, that has nothing to do with it. What we did was we had asked for a request for qualifications, request for proposals that closed at the end of August. Once that closed, we had our preferred supplier, which we had provided that information to the various school divisions, and that's when we placed the order for 6 million masks. We're expecting them to be delivered in the 3rd week of August so that we can have them available for the school divisions for the beginning of the year should level 2 be implemented. The other thing I want to just make a clear point of is the school divisions have been acquiring PPE for some time as well. We know that, I'll use Saskatchewan Public as an example, others certainly as an example, that they've been acquiring masks and shields for distribution to their school professionals, teachers in the classroom. So school divisions have been acquiring PPE as well. We wanted to make sure that if we went to level 2, with the plan, that we were able to supply the masks to the school divisions across the province so that they could comply with any change in that level.
What about concerns of physical distancing in classrooms with some fairly large class sizes?
Well, there are certainly some large class sizes in Saskatchewan. One of the things that's been emphasized in the local plans is some physical distancing. We know that a lot of school division plans call for separate pods to be in those classrooms so that we can minimize the amount of contact between students in those classrooms. Currently, there's no restrictions on the amount of class sizes. If we ended up going to level 3, there's requirements within that level to amend that, to make sure that class sizes are smaller in the event we have to go there. We certainly hope we don't. But at the present time, the local plans certainly have accommodated for that in creation of pods and those kinds of things.
Do you have any strategy in place for immunocompromised kids going back to school?
Well, we sure do, and one of the things that the local plans speak to, and we've spoken to this on a number of occasions, for immunocompromised children that don't want to return to school, if that's the choice of their parents, that there will be arrangements put in place between school divisions and those parents to make sure that children get a quality education. There's a number of options that are available, whether that's pods, individual pods, whether that's remote learning. There's a number of ways we can do that. But certainly that's been a significant consideration. We've heard a lot about that. But as part of the local plans, and I've spoken to this on a number of occasions, school divisions will be working with their parents in the case of immune-compromised children to make sure that they get quality education in a safe way.
What do you have to say to parents and teachers who say this plan isn't safe and kids aren't a priority?
Well, I would disagree. I mean, I think the plan is a good plan. The plans certainly that have been put forward by the school divisions are comprehensive, and there's a lot of room for movement. Again, we have relied on the advice of the Chief Medical Health Officer, not only in the review of the plans, but in the implementation of the plans. And they've been reviewed by school board trustees, they've been reviewed by representatives of the Saskatchewan Teachers Federation, so I'm quite comfortable with the plans. I know that this is a passionate issue for many parents and for many people in the community. We want to make sure we get this right, that we have the right balance. This isn't just about educating children, this is about making sure that they can return in as normal a way as possible, having regard to their mental health, having regard to the requirement for socialization, all the things that are important to children as they're growing up. So we're not just really focusing on what the educational opportunities, but we're talking about making sure we strike a balance that deals with the whole child.
There are currently no plans for adjustments for the school bus capacity. Do you see that changing at all?
Well, the requirements in the initial plan will be for children in various in family settings to be seated together, that seating plans be established in the buses so that we can properly contact trace. There may well be some changes to that plan, whether or not the Chief Medical Health Officer decides that we're going to level 2, or whether school boards decide that they want masks on buses because those are children are in close proximity. Those will all be things that we think about, but transportation is a key element of making sure that we get kids to school safely. We've encouraged parents to the extent that they can to transport their own children to school, but you may well see some changes with respect to protocols around transportation as well.